Hello class, my name is Teresa Castillo, and today I will be presenting my informative speech with presentation aids. For today's video, I wanted to talk about something a little bit more serious and something that we don't necessarily talk too much about. I know that personally in my field of study for human services, it is a big topic and it is a very real thing and a very serious thing to discuss. And there's many of us know of people who have struggled with depression and those things, and we know that it is very much a mental thing. But one thing that we do lack is giving information and informing ourselves and others around us about the physical effects that depression has on the body. There are a lot of effects on the body when you have depression. A lot of things go on in our physical brain that do cause a lot of chemical imbalances and those kinds of things. But there are also things, and depression shows itself in a very physical way as well. And in turn, they both go hand in hand, and they cause a lot of damage to the body because it is damaging to the body and it is damaging to the brain. Some of the effects that it has on the body is feelings of sadness or emptiness, insomnia, trouble with memory or decisions, preoccupation with death, risk of heart attack, feelings of clinginess, weight fluctuations, constricted blood vessels, fatigue, increased pain sensitivity, weakened immune system, and a lower interest in sex. A lot of these things can be described as mental issues, but it in turn also affects the physical body. There's things that go on in our brain that leads to those things, like we have trouble remembering things because of the depression. We in turn lack sleep. We're not sleeping well, we're not sleeping as we are supposed to, which that eventually leads to way more problems if you're not sleeping and resting your body. People who are depressed are more likely to die of a heart attack because of it. Constricted blood vessels, depression and stress causes blood vessels to constrict, raising the risk of cardiovascular disease. So as we can see, there are many things that, and I think it's important to talk about these things because there's not a lot of people, that focus too much on the physical side of things. And, sometimes just getting up and going and taking a shower or doing one small productive thing can have a big effect on our body. Just the simple act of getting up and showering, that will lead to a great impact within the body and the brain, and they do go hand in hand. And I think that the reason why I'm focusing so much on the physical side is because we must take care of the body as well. There is counseling, there are all these resources, for the mental side of things, for the psychological side of things, but a great deal is also the physical side of this, because it does have a great effect on us. In summary, I just wanted to, inform more about the physical side of the effects of depression on the human body, just because, as I said before, it's not something that is talked about as much, and it is real. Depression is a very real thing, not only, in our day-to-day, we know of people who are struggling, who are going through very, intense mental issues, mental illnesses, and depression is included in those things. And we just need to make sure that we are informed and that, that we're there for the people who need us in those moments of, when we are weaker, and that's fine. But thank you so much for listening. I just wanted to come here and just talk about, how much and how important it is for us to also take care of our physical body in those moments.